February 24th, 2026. I'm Dr. Deukmedjian. Our patient comes from Virginia. She has a 10-year history of chronic, debilitating lower back pain. It affects her legs on both sides. In addition to this, she also has thoracic pain at the T10-11 area. Her MRI demonstrates disc injuries such as herniated disc, bulging disc, T10-11, L34, L45, L5S1. Our plan is to fix 5 disc areas, 5 annular tears, and to also treat a piriformis muscle release. She has a piriformis syndrome with a torn muscle in her buttock on the left. We'll do that later, but we'll get started with the discs. If you have questions, feel free to ask. In the meantime, we're going to share with you the 30 different causes of back pain. You can watch the video and learn what are the most common causes of back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with x-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You can see from our animation that there are 30 very specific sources of lower back pain that's chronic, meaning it lasts more than 2 weeks. And the most common of those sources is a damaged disc, or we call them herniated discs. You might know them as bulging disc, ruptured disc, protruded disc, extruded disc. But in the end, they're all we call disc injuries. Sean? AP? Disc bulge is a small herniated disc. We all know what a herniated disc is. If you're not sure, go to our website. You can see it online. I'm in the process of getting into her discs that need to be repaired right now. And the L3-4 on the left side is where I'm targeting right now. If you have questions, I'll be happy to answer them.
At this moment, no current questions.
Sean? She has a very interesting spine. Sean? Sean? Her spine is so medial and Sean? Narrow. Sean? I don't think I've ever seen such a narrow spine. Sean? Sean? That's good. AP. Shot. Lateral. I may have to go more medial. Oh yeah, it pulled back, that's why. Shot. That's not bad right there. So what are we on here, Henry? Are we on a video?
We came back from a video and we just got a question.
Shot. I'll take the question.
From Lee on Facebook.
All right, Lee, I'll take the question. Shot.
Asking, could it be caused from car accidents, or what could cause that much damage to your disc?
Shot. AP. Sorry, Lee, I'm navigating right now. I'll tell you in a moment. That looks really good. That looks really good. We're right where we need to be. So Lee, great question. The answer is always trauma. The question is what caused the trauma. Shot. And in her case, I'm not sure how she hurt her discs. I don't recall. No, it's not the children. It's some type of a trauma. It's either falling off of a bicycle, skateboard. I mean, you use your imagination. Some type of serious trauma of falling, or a car accident is another option. A sports injury long ago, but those cause tears in your. I'm going to go for T10-11. They cause tears in the annulus, or the ligament holding the bones together, and then that causes the herniation to get out and cause pain. Okay, so it's really the herniation into the tear of the nucleus pulposus that generates the pain, and that's what over time creates chronic back pain. Okay, I'm gonna get into the 10-11 disc next, but let's just verify. I want to see 3, 4. 1, 2, the next one down should be 3, 4. There it is. So that's 3, 2, 1. I agree. Then 12 is the first rib. We're going from the right side. Move up north, please. This patient has a thoracic disc herniation at 10-11. You can see the first rib is 12, 11, 10. I need to go up. She actually put an X where their pain is, and that lines up perfectly with the 10-11. All right, let me have a needle. I'm going to place my needle into the 10-11, and then we'll be into all the discs that we need to be into. And we can get started on actually fixing her back. 12, 11, 10. Wait, shot. Shot. All right, let's go with a lateral view. Any other questions?
At this moment, no current questions.
So let's show our audience how a disc injury, a traumatic injury to a disc, causes back pain. Sean?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Let's get, hold on a second, folks. Let's get orbit fixed, because I'm not seeing, I think we're off 1 degree on orbit. And WAG. Maybe orbit, maybe 1 degree. WAG is probably a degree. Folks, I'm just getting my fluoroscope lined up perfectly with the spine. I think it's orbit. Yeah, that looks really good, actually, Jordan. So I'm looking at the pedicles and the back of the vertebral bodies just to make sure everything's lined up, the disc space. There's a whole bunch of things I look at. But that looks perfect. Let's get another AP just to verify. This is going to be, these are the hardest part of the case, folks. Once I get the needles in properly, then the rest of the surgery is easy. 12, 11, 10. That's 10, 11. Everyone agree? You agree, Luis? Jordan? All right, so we're in the right spot. We're ready for her to wake up and do our discogram. Sean? How is she?
Can you open your eyes for me? Don't move. Are you okay?
All right, well, our patient is getting ready. What we're doing the discogram for is we want to test to make sure the discs we're treating are truly the cause of her pain. Are you having any back pain?
She said no.
All right, so we looked at the MRI, we examined the patient, and we realized there's a small herniation, we call it a disc bulge. Huh? What is it? I'm just writing on your back. You're my chalkboard. Is that okay? Said yes. All right, she's had back pain for 10 years. Sorry, I'm not left-handed, but I've been writing left-handed for you. This is the 10-11. She put the X right there. Then she's also got pain at 3, 4, 4, 5, 5, 1. Are you excited? She said yes. Do you want to get your back pain fixed? Huh? I didn't understand you. You want to be back pain free. Good for you. No, no narcotics. You're right. We want to make you pain-free without drugs. Okay, again, she's from Virginia. She's here because she has pain in the thoracic as well as the lumbar. We determined through our Deuk spine exam, which is available only at Deuk Spine Institute. Deuk spine exam, where her pain was coming from. Are you having any pain? Yes. Where is your pain? Where? Where do you feel it in your leg? Which leg? The side? Just the side. All right. How bad is that on a scale of 1 to 10?
8.
8. Is that where you get your back pain? Is the highest it went was an 8? 8 out of 10, and it's concordant at T10-11. Can you document that, please? All right, that's one of the bad discs. We found it. We're going to fix it later on, okay? Once you go to sleep. Is it better? How bad is that on a scale of 1 to 10? 10. Is that your typical back pain? Congratulations. We found that was L45, by the way. L45 was 10 out of 10, and it's concordant. Better? All right. How bad is that on a scale of 1 to 10? 10. Is that your typical back pain? Congratulations. We're almost done. We're going to put you to sleep in just a moment. So far, we've tested 3 discs, 8 out of 10, 10 out of 10, 10 out of 10 pain, and all concordant. How bad is that on a scale of 1 to 10? 10. All right, so L34 is a 10. Is that where you get your back pain? Congratulations. We've identified the source of your back pain. When you wake up, all that pain will be gone. I want you to count out loud from 1 to 100. All right, folks, great news. So we verified the 3 discs we're fixing are indeed causing her back pain. What are we doing? 5-1 here? Let's do 4-5 first. Wait. Are there any questions?
At this moment, no current questions.
Well, then in case, Henry, let's show the audience how we repair these discs and get rid of the discogenic back pain using the Deuk laser disc repair. Peer-reviewed, published procedure. FDA approved. You're doing great. Hang in there. You're doing
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see on our video that we use the endoscope and laser to find and clean out or debride the tear and herniation stuck within the annular tear in the back of the disc. That eliminates the back pain that the patient has from the disc. Laser. We're going to do that right now. So we're looking at the annular tear and herniation. Any questions?
At this moment, no current question.
She's perfect for me. You happy with her?
Yeah.
Okay, good. Huh?
I'm hoping to do everything.
Well, you just let me know if we need to stop. All right, folks, we are inside the tear. You can see some blue stuff, some pink stuff, some orange stuff. The blue is the degenerated nucleus pulposus that is part of the herniation. The pink is inflammation within the annular tear. The white, thick stuff is scar tissue, and the gold color stuff, orangey gold, right there is calcium, called dystrophic calcification. It is the dystrophic calcification that indicates how old this disc injury is, along with the scar tissue. More scar tissue, more calcification equals older injury. Less scar tissue, less calcification equals newer injury. There's the tear right there, or part of it. This is a complex tear. It's got 2 tear planes. Any questions?
Yes, we have 2 questions. This
Now,
next
before I take the questions, let me just say, you guys see the laser fiber there at 12 o'clock?
Yes, we
That
do.
fiber is 1 millimeter, 1 millimeter wide. Just to give you a perspective, the inside of this metal tube is about 5.5 millimeters, 5.5. The outside of the tube is 7. So this whole area we're operating in is just 1/4 of an inch. This is ultra minimally invasive spine surgery. It doesn't get more ultra minimally invasive than this. And for those of you, we were talking last surgery about the whole industry, the spine industry, and how corrupt it has become over the years. Totally lost focus on patient care. It's driven by greed and profit, in my opinion. Again, that's just my opinion, okay? You don't have to agree with me, it's fine. But we do have a very interesting movie you can watch. It's called Spine Scam. Henry will put the link in our YouTube and Facebook channel so you guys can watch the movie. It's free. There is no cost. It's a movie designed to educate the public about some of the issues happening right now in the United States and really the world stage for spinal surgery. It's a problem that doesn't just exist in spinal surgery. It also exists in pain management and other fields, but I'm not an expert in other fields. All right, you got the link for Spine Scam, the movie?
Yes, we do. Already up there, and we have 2 questions.
Does Anthony know how to get that link up there?
Yeah, just copy and paste.
All right, very good. Thank you.
Next question from Lee, once more on Facebook, asking, would disc pain get worse with age a problem?
Yes, disc pain, pain from an injured disc like this, usually gets worse with age. And I will tell you, I've treated probably 250,000 or more patients now with disc pain in the last 25 years. Here's what I would say. All right, it's probably more than that. But here's what I would say. Disc pain typically starts sometime after an injury. It doesn't start the same day necessarily. It typically, if you injure your disc in an accident, the pain is there maybe for just a day or 2, but usually it goes away and it stays gone typically for a few years. But as you go through life doing regular activities like shopping, carrying grocery bags, moving furniture in your house, working in the yard, all those regular, we call it daily activities or activities of daily living. Those bending, twisting, lifting puts a lot of pressure on your disc, and it causes the jelly to squeeze out and herniate. And what see right there, that right there is the herniation, and that's the tear. You're looking at the tear right here, and you're looking at the herniation right inside the tear. So when you get this herniated nucleus stuck in the tear, your body's inflammatory system starts to attack it. And the inflammatory system will attack it and attack it nonstop, day and night. And what happens is over time, you start to feel those new little pain nerve fibers that your body's bringing in to that area. You see, chronic inflammation always creates new nerve fibers. It's called neoneurulation. Neo is new, neurulation. Neurulation means the ingrowth of new nerves, okay? So you've got these small little nerves that start growing right into that area where the inflammation is happening. And over time, you get basically a ball of these little pain nerves. And all they are is, these are pain nerves. They have little pain fibers. So they sit there, and every time you bend and twist and lift, you reset off the inflammation. You create more of those pain fibers growing into the area of the annular tear. What our surgery does, it removes not just the herniation, but also we get rid of the nerve fibers that are painful, that are in the annulus. You can't see them. They're invisible to the eye. You would need a microscope and some stains to see them properly. But they're there, right inside this stuff right here. So by blasting away the herniation stuck in the tear right here, the blue stuff, I'm also not just getting rid of the herniation, but I'm also cleaning up the scar tissue inside the tear that prevents the body from healing it. I'm getting rid of the calcium or bone stuff that's starting to form in here. And I am getting rid of the pain fibers, the nerve fibers, okay? So by getting rid of the pain fibers, the calcium, the scar tissue, and the herniation from out of the annular tear, you allow the body to naturally heal the tear. And this is the procedure I pioneered here at Deuk Spine 20 years ago. I've been trying to tell the world about it. I've gone to the big neurosurgery meetings and presented my work. They've accepted it after reviewing it, and they've had me talk, but it's changed nothing among neurosurgeons. They're not interested in this technology because honestly, I don't know why. I don't want to speak for them, but somebody needs to hold them accountable for why they're still recommending invasive surgery when this surgery itself is the best alternative. That's my opinion about that. So I think I know the answer, and the movie Spine Scan may answer a few questions. All right, let's take these questions.
Next question from Bridget on YouTube.
Hi, Bridget. Welcome.
Asking, how long can you expect recovery to be?
Her recovery will be 1 hour. That's it. 1 hour, she'll leave here. She can walk on the beach in an hour. She can go to dinner with her husband in an hour. There is no recovery. It's 1 hour. This is outpatient surgery. It's done under sedation. We have a phenomenal anesthesiologist, Dr. Berndes, and we got a great team, and combining the team, the approach, the surgeon, the anesthesiologist, everything, we've gotten it to where our patients basically need 1 hour recovery. Great question.
As of now, no current questions.
Yeah, we'll do it. Why not? Diabetic? All right, so 1 disc down and 4 more to go. How's everything? Blood pressure? All right. We just did 4-5. We'll do 5-1 on the right. If you have questions, type them up. I'll do my best to answer them for you. We're entering the 5-1 disc. Seems barbaric to use a hammer and drive in a metal stake, but keeps the vampires away. Right, Jordan? Best vampire movie. We're taking nominations. What was the Tom Cruise one? It was, I can't remember the name of the Tom Cruise vampire
Interview
movie.
with a Vampire.
Interview.
I did not like that movie.
All right, so we need voting here. Let's see who's going to get, which movie gets the best. Come on, folks. Luis, best vampire movie. Which one? From Dusk Till Dawn. All right, we got to vote for Dusk Till Dawn. Quentin Tarantino. It wasn't his movie. It was Rodriguez's movie. Was the director. But I think Tarantino had something to do with it. All right, we got a Dusk Till Dawn. We got Interview with Vampire. Jordan? Which one? Just called Dracula? All right. Gary Oldman. All right. We got a Gary Oldman. Is that the name of it, Henry? Dracula?
There's like so many variations of Dracula. I'm sure he played Dracula at one point. Yeah.
Brad Pitt, did he play Dracula? I don't know.
He played a vampire with Tom Cruise in Interview with a Vampire.
All right, is that your vote, Berndes? Your vote is Interview with the Vampire. We don't know Hector's vote. We know Luis is Dusk Till Dawn. Mine is got to be Dusk Till Dawn as well. That's my favorite vampire movie. However, I really do like that Dracula one as well. You guys know which one I'm talking about? I don't know the name of the actor. But it took place a long time ago. He was attacking the Turkish soldiers. Dracula. All right, what else? Jordan, what did you say? Jordan, do you have one? You're going to have to say what? Blade. All right, Blade's good. The first
Finally,
one.
I was waiting for someone to say that.
All right, we got a Blade. We got one Interview with the Vampire. We got two From Dusk Till Dawn. What do you got? Hector? Dracula. We got one Dracula. It's the one where he goes in the cave and meets Dracula, right? And he turns into Dracula and the old guy goes away. Yeah? That was a great movie. That was my second choice. All right, Henry, have you picked one?
Yeah, Blade.
Blade.
Someone said it,
Sorry.
Jordan, so great pick.
So we got two Blades. Two for Blade. Right? Henry, you keeping track? You and Jordan?
Yeah, him and I.
All right, we still need to hear from Anthony. I know Anthony's got something in there. He's going to pull
Van
one out.
Helsing.
Is that what Anthony said?
Yeah.
You can leave.
Oh, it's a fine
Van
movie.
Helsing?
It's better than Interview with a Vampire, in my opinion.
I'm not going to say anything. I like Anthony. Anthony's a smart guy. Well, Anthony, have you seen From Dusk Till Dawn?
Yes, he has.
Oh, all right. And you know, that's Salma Hayek in that movie,
Yeah.
right? Like, that's her making her debut, I think, in movies.
I think that was her debut in like American films.
My God, she's beautiful. That just that Salma Hayek dance scene, right, Luis? That's enough. That's it, right there. You could end the movie, start the movie and end the movie in 5 minutes, and it's over. Huh? All right, who are we missing?
We have Lee from on Facebook that says Twilight.
Twilight. Okay, Twilight. All right, we'll leave the voting open for another 10 minutes or so. Get your votes in. Best vampire movie.
Nicholas on YouTube says Dracula Untold is the other
That's
movie
the
Doc.
one. Yeah, that's the one. Dracula Untold.
I don't think I've
That's-
seen that.
Oh, that's a great movie.
Yeah.
I can't remember the name of the actor. He's a famous actor.
Oh, Luke Evans, Dominic Cooper. Yeah, I know these guys. Yeah,
That's a really good one.
yeah. Oh, Charles Dance is in it. He's a huge, famous British actor. Oh, I've seen him. Okay. Yeah, no, I haven't seen it, but I'm like, I definitely seen this around. I'll give this a watch.
So is that
Anyway.
his vote?
That is, I believe that's Nicholas's vote. Yeah.
So Nicholas is going for Dracula Untold, or is he just telling us that's the name? Because I didn't know.
He said that Dracula Untold is the other movie Doc I was
Yeah.
talking about, I think.
Oh, okay. So I don't know if that's his vote, though. Maybe that is, or maybe it isn't.
Oh, no, I apologize. He's saying, like, that was the movie that you guys were talking
yeah,
about.
yeah.
You couldn't
No, I
remember
get
the name.
that. I get
Yeah.
that. But I didn't know if he's also voting for that.
I would assume that's his vote.
I don't want to assume anything.
Yeah, I know.
I'll let him decide for himself.
Of course.
All
And then
right.
we have a Dwayne on Facebook that says interview with a vampire.
Interview with the Vampire pulls ahead. 3
Please.
votes. Who's going to save the day?
Someone want to switch to Blade?
You want another Blade vote?
it's,
Blade was good.
I'm surprised nobody got Sinners, the new vampire movie that came out last year.
I haven't even seen it.
It's good. It's really, really good. It got nominated for 16 Oscars, which I think is overkill.
All right. Well, there is another one that I thought is pretty darn good, but it's not as good as Dusk Till Dawn. It is Stephen King. What the heck is the name of King's movie?
Lost Boys?
Oh, Lost Boys is another great one.
Yeah.
Oh my gosh, I forgot about that. No.
I'm changing my vote.
No, I've seen that.
Oh,
yeah.
were you changing it to Lost Boys? Oh, really? Yeah, Lost Boys is a really good one too, from the 80s. Yeah, the soundtrack's amazing. That was a great soundtrack. All right, so Berndes changed from Interview to Lost Boys. So Interview just pulled back to tied first with Dusk Till Dawn. So the other one with Stephen King is, what the heck is the name of it?
I'm looking it up. Hold on.
I just watched it too. It's got Rob Lowe. No, it's got Rob Lowe. The clown is not the vampire. The clown is it. No, it's not Pet Cemetery.
Salem's Lot.
That's it, Salem's Lot. That's the Stephen King vampire. I'm not voting for Salem's Lot, but I mean that's another good one.
Oh, it's the same director as Texas Chainsaw Massacre, so it's got to be good.
Oh, it's good. You should watch it.
All right. Oh, I've seen the. I'm just looking at the cover for it. I've seen the cover and never seen the movie itself. I think there was a reboot of it too.
Yeah, that's the Rob Lowe one. It's got Rob Lowe in it. It was probably came out about 4 or 5 years ago. Maybe.
Oh, okay.
Yeah, I thought Rob Lowe disappeared off the face of the earth, and then I saw Salem's Lot with Rob Lowe. I'm like, wow, that's cool. He used to be like one of the biggest actors of the 80s. Male actor. Girls were crazy about him.
He was part of that. What's that film group called? The Brat Pack. Or something?
Yeah.
With Molly Ringwald, Anthony
Yep.
Anthony Burke Hall, something like that. Yeah, it was Anthony Hall something, and then that other guy, Judd something,
Yep. The bad boy.
the bad boy. Oh yeah, there's a new Salem's Lot that came out 2 years ago in 2024.
Is that the one with Rob Lowe?
No,
All right. So the Lowe one was older.
yeah, the low one was
Wow, I
much
didn't
older.
know that. Yeah.
My first patient is doing very well. Is it okay to discharge him?
Yeah, I've already seen him twice.
I just want to read it.
Yeah, he can go. Yep. Our second patient can go too. I saw him as well. He's doing good. All right, wait, do we have any more votes? Vampire movies. All you viewers out there watching our laser disc repair, we're going for vampire movies. Best vampire movie. So far we got a tie. Interview with a Vampire is tied with From Dusk Till Dawn. There was another one too that I saw recently with, well, there's Voyage of the Dementor?
How about that old one with, what's that, Bela Lugosi?
Who?
The first
Oh, yeah. The first one. The classic.
Bela Lugosi.
Dracula or whatever. No, there's another one that came out
I know that one.
with Edgar Allan Poe or something like that. Maybe it was a wolfman or werewolf instead. All right. So we're just about done. You can see some fibers of the annulus right there. And you can see the blue stuff is the nucleus stuck inside the tear. So when you get an annular tear, not every single annular fiber gets torn, right? But a lot of them do. And you can see there's an intact fiber there. But we're still going to have to sacrifice it because I got to get all this herniation out so this wound will close. When you do these surgeries, never forget about the lateral herniations. Got to get those too. Grab her. Just about done with this disc. This is L5S1 and she's doing great. She's stable. She's not losing any blood. If she had to have a fusion for her back, it would be a much bigger surgery, far more invasive. There would be cutting of muscles, cutting of ligaments, cutting of bones. But with the Deuk laser disc repair, we achieve better results than spinal fusion, and we have far less trauma to the body, far less bleeding. We've never had an infection with this surgery, not one. We've also not had any surgical complications with this surgery. All right, just about done. Thank you, Luis. You can see some fat right there. You guys see the fat?
Yes, we do.
So I just got word that Arias Deukmedjian, my son, he's in college. He's at Princeton. Princeton is very well known for physics. And the greatest physicists of our time, Albert Einstein, was there teaching as professor. Also Oppenheimer. So Princeton University in New Jersey is very well known for physics. And my son just scored 100% on his physics exam. His third year, the highest grade in the class. Did not miss a single problem. It looks like he's following in his father's footsteps. His mother too. She's also an incredibly gifted student. All right, just about done here. And you're all very lucky because he wants to go into medicine. Laser on. Thank you, Jordan. Ooh. It's all right. I know. It's a much faster rate. Go ahead. You can fix it. All right, any questions?
Yes, we got 2 questions. Next one from Bridget, once more on YouTube, asking, have you ever had to redo this surgery? Could this also be hereditary?
Great question, Bridget. Have we ever had to redo the laser surgery? The answer is yes. Our redo rate is 1%. That means 1% of our patients will reherniate right through this tear. And I've got to take them back and do another surgery. Or they can get a fusion if they want. I don't recommend it. Berndes, she's coming too. You want me to stop or can I keep going? All right, so, yep, this is the most sensitive part of the disc. You're right. So we have to repeat 1%. And it's not because of the surgery. It's honestly because of the patients. They just don't listen to my restrictions. I tell them very specifically what to do and what not to do after their surgery, but they don't listen. Some of them think they know better than me, which is shocking, believe it or not, when it comes to recovering from the surgery, since they don't have the experience I do. I don't know how they could. But basically, it's simple.
after the surgery, you want to avoid lifting items that are over 40 pounds. Nothing over 40 pounds. And you want to avoid contact sports for 1 year. No football, rugby. As far as other things like golf, you can go back to golf pretty quick. Just depends on your situation with your discs, how bad they are, how many there were, how good the surgery went, and what kind of golf you play, right? So if it's Tiger Woods, for example, I would probably have to look at his disc, see how bad it is, see how well the surgery went, and then I could give him his recovery times in terms of returning to golf. Great question. I missed the second part of her question, though.
Asking, could this be hereditary?
Yeah, there is definitely a hereditary component to painful discs in your back and neck. It runs in families for sure, and we see it all the time running in families. So very, very common. I think there's a genetic predisposition to having disc injuries. Great questions, by the way.
This next one is coming from Amar on Facebook.
Amar, welcome. By the way, look at this tear. We've just cleaned it. And remember, the inside of this tube is 5.5 millimeters. So that tear is now about 3 millimeters. You got a little fat there. But that's it. We just cleaned the tear, so now it's 3 millimeters. So it went from about 7 millimeters to about 3 millimeters by removing the herniation, the scar tissue, the calcium, all that junk. All right, Amar. I'm all ears.
Asking, what is the acceptable rate of recurrent disc in this approach, and does it work for a migrated disc? What are the instructions or measures that decrease risk of reoccurrence?
So, great question. First of all, it does work for this approach does work for migrated disc, but it depends on where the disc is migrated, how far up, how far down, how far medial, lateral. And then as far as the restrictions, I was talking about them just now. It's no lifting over 40 pounds your first year, no contact sports your first year, and no bending over to pick things up from the ground for the first really 3 months. Okay, we're going to do the thoracic disc next. Yes. Thoracic. Since I'm here, we might as well do it. Let's just see. I think we can use the larger scope. We'll see. Let's do the thoracic next. Great questions, by the way. And I think I answered them all, but maybe I missed something. If I did, Henry, will you tell me, did I miss anything?
From the last one, I believe the last question was, what are the instructions or measures that decrease risk of recurrence?
Yeah. So the measures or instructions are, as I said, no bending to pick up anything up from the ground for 3 months. No lifting over 40 pounds the first year. And no contact sports the first year. The problem is some patients don't listen. They literally feel so good that the next day they're like, I have no more pain. I'm just going to go do my job, like landscaping, mulching. I'm going to pick up cement bags and carry them up, to the 3rd floor. And, people just don't listen. And so as long as you listen to my suggestion, Shot, you're going to do fine. Shot?
No current questions, but we do have a comment coming from Lee once more on Facebook saying,
Sean?
Great job to your son.
Thank you, Lee. Thank you. AP? Yeah, I'm very proud of him. It's hard these days to get kids excited about school, but he's really a good kid and understands the value of a good education. A lot of people don't think education is important anymore. I think it's the most important thing you can get in your life. It's far more valuable than anything else. It's the education, my education in med school, university, biochemistry, cell biology. My education is what made me who I am today. So I value education. All right, I have to open this another millimeter. Let me have that 11 blade. Everything okay, Berndes? Yeah. So I just opened the incision another 1.5 millimeters to accommodate the tube. And I like to use the larger tube when I can on the thoracic, especially the lower thoracic discs, because they are, I got it, shot, because they are larger, like wider. And I really want to get a good debridement out of there. I want to get all that herniation out, and having the wider tube and scope makes it like not easier, but more doable, more successful at achieving that goal. All right, keep the questions coming. If there are none, we've already shown how a herniated disc causes back pain, right?
Correct.
And how we fix it with the laser and scope?
Correct.
Why don't we show our audience why the Deuk laser disc repair is better than other types of spine surgery like laminectomy, discectomy, fusion, artificial disc, spinal cord stimulator, all those things that don't really work that well for back pain.
Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening.
Welcome back. You can see how our procedure here at Deuk Spine, the Deuk laser disc repair, stacks up against other procedures. You okay, Jordan? Yes, sir. And it just, in my experience, our procedure is safer, faster recovery, less trauma to your body, no need for narcotic painkillers after surgery from us for our procedure, immediate return to work and normal life the next day, no trauma to your muscles and soft tissues, and I think it's more effective than any other treatment out there. We have a 99% cure of back pain rate with this surgery, and there's no other treatment in the world that gives a cure rate of 99%. So, all right. Any questions?
Yes. Next question from
Shot?
From Bridget, once more on YouTube.
Hi, Bridget. Once more on YouTube.
Asking, how long does it take the incisions made during the surgery to heal?
That's a great question, Bridget. Shot? It takes about 3 days to heal. 3 days. Shot? Shot? Why do you ask, Bridget? Are you a swimmer? Just curious. You can actually go in the shower. Hold on. Shot? You can go in the shower, the tub. Yes. Within 3 days. The tub, 3 days. Shower the same day. You can shower the night of your surgery. She can take a shower tonight. she just can't soak her body in, a tub or a pool, because that needs 3 days for those incisions to seal. All right, we're done here with that. Folks, everything's going well for this patient so far. No issues. We've lost about, 5 cc's of blood. 5 cc's of blood is 5 times 20, 100 drops. That's nothing. If we had done open surgery like laminectomy, we would have lost a liter or 2 of blood. Most surgeons will lose about a liter of blood for something like this. We lost, a liter is 1,000 ml. We lost 5. So think about that. Really, no blood loss, no post-op pain, immediate return to normal life, and a 99% cure rate for discogenic back pain. Any questions?
At this moment, no current questions.
Here we go. We got 2 discs left and a piriformis. I say we just keep going and get the piriformis done, Henry.
Understood. We'll do that. That's perfect.
Our last patient, folks, is going to be a patient who travels from Ohio, right?
Yes.
And she has facet joint pain, sacroiliac joint pain, and piriformis pain. She has 4 areas, 4 sources. We're going to fix all 4. This patient, how many areas of pain did she have? Let's count it. T10-11, disc, L3-4, disc, L4-5, disc, L5S1 disc, that's 4, plus a piriformis on the left, that's 5, right? She had 5 sources. So this patient had 5. The last patient we did had 2 in his neck. The patient before that had 4? No, 5. 5 also. So we had a 5, 5, 4, 2. What it means, folks, that's so important to understand is that most patients have about 5, really 4.5 causes of back pain. So if your surgeon is only fixing 1 cause, then you're still going to have pain. That's why you come to Deuk Spine and get the right treatment done the first time. There was a question earlier about, do we have to retreat our patients? And the answer I gave was regarding reherniations. Our reherniation rate is 1%. That means out of every 100 patients we do this laser surgery on, we get a 1% that reherniate from doing something they're not supposed to do usually. But there is another group of patients we have to reoperate on, and that is people who have more than, they have another cause of pain that we didn't identify. Now, we can identify every cause of back pain as long as the patient has the back pain on happening when I'm examining them. Because if the patient does not have back pain at the time that I'm examining them from an area of their spine or their back, then I cannot diagnose it. Laser? It's okay, you're fine. So it's very important for people to understand I can only diagnose back pain source when the patient has back pain. So as long as the patient is accurate with where their pain is coming from on the examination, I can diagnose all their pain using our Deuk spine exam. Okay? However, if the patient doesn't have that pain at that time and maybe doesn't remember it during the exam, they won't show it to me. And then I'll miss it. And then they end up having it flare up later on, and then they have to come back and get it treated. So that's the only caveat to treating back and neck pain, is that There is no MRI or CAT scan or x-ray that tells you where back pain comes from. It's a clinical diagnosis, meaning it requires the doctor to make that diagnosis clinically through their knowledge of the anatomy of the back, their experience dealing with sources of back pain. So I cannot use a magic crystal ball to diagnose people's pain. I need to see where it's coming from with my own eyes, and my hands are theirs. Henry, any more votes on the vampire, best vampire movie?
I think that's it.
Huh?
I think that's it. I haven't seen any.
So what do we got, a tie between
The tie between Interview
Interview with a Vampire
and Lost Boys.
No!
I don't know what the. If
Yeah.
that's the case, then Interview wins.
How many Lost Boyville votes were there?
I don't know. I can't count in the.
I think there
OR.
was just one, wasn't there? Or there were two
I
Lost
thought
Boys?
I thought there was two.
All right, well, I'll tell you what, then it's a three-way between Interview with a Vampire, Lost Boys, and what the heck is the name of that, huh? Luis? Dusk Till Dawn. Have you seen that, Berndes? Yeah. So you did finally see it? Oh, you saw it? I bet you did. Was your wife home when you saw it? No. I didn't think so. It's one of those movies you don't necessarily watch when your wife's home. I was watching a movie last night called Body Double. It's from the 1980s. Which one? Dusk Till Dawn? Oh. Anybody see Body Double? That is a great movie. Great movie, Body Double, yeah. Great movie. It's from the 80s, 1984. And, huh? Dusk Till Dawn? I think you're right. It's early 90s, if not 90. So Body Double blew me away because I forgot it has this one actress from the 80s that's famous. And which one? Dusk Till Dawn is 96, yeah. Sounds about right. Anybody remember the movie Saving Private Ryan?
Of course.
Remember who was in that? Huh? So Tom Hanks, right? Meg Ryan. Right? Wasn't Meg Ryan in that? Huh?
Saving Private Ryan?
Wasn't she? Who was in, what was the female? Wasn't there a female in Saving Private Ryan?
No.
All right, which one am I thinking of then? I apologize.
I think you're thinking of Sleepless in Seattle or You've Got Mail, both with Tom Hanks.
Maybe.
That's why I'm like, those. I think that's like one of the three movies that threw together in. Or the only two.
You're probably right. All right, look at this piece of herniation right here, folks. I want you to look at that. Look how smooth it is. See that? It's smooth. The reason it's smooth is because the inflammation has been beating on it, tearing it up the surface, smoothing it out, kind of like a rock in a river. You know, if you throw a rough rock in the river, you come back the next day, it's still got rough surface. But if you come back a year later or 10 years later, it's got a smooth surface. And that's exactly what we're seeing. We're seeing a piece of herniation with a smooth surface because the inflammation has been chewing up the surface, sandblasting it. Anybody know what sandblasting is? Huh? Yeah, it's an old technique from a long time ago where you blast sand on glass and it etches the glass and creates a design. It's called sandblasting. Well, that inflammatory stuff, all the enzymes being released in this tear, they work on the herniation and they try to dissolve it, but they can't. So what it does is just smooths off the surface. You guys just saw that right there. All right, so far everything's going well. We're just about done. We got one more disc and then a piriformis. Any questions?
Yes, we have another question from Bridget once more on YouTube asking, do you have a recommendation on age limit as to who can have this surgery, or does it depend on your health?
That's a great question, Bridget. We do not discriminate based on age, ever. You can be 90 years old, you can be 15 years old. I've had 15-year-olds, I've had 90-year-olds, 92-year-olds, 97-year-olds. I do not deny people quality of life. It is my job as a doctor to help them any way I can, but it really comes down to their medical condition. As long as they are medically optimized and safe to proceed with surgery like this, we can do it. One of the advantages of this type of surgery over invasive spine surgery is we're not losing blood, so there's no hemodynamic shifts, and we're not creating massive trauma to the body that require the use of narcotic painkillers. Think about how important that is in recovery. When you're older, you don't want to be on narcotics. Why? Narcotics are, number one, they're high risk for killing you. You can die from asphyxiation. Number two, you're going to get constipated. And then with constipation, you get all kinds of problems, right? You can have a necrotic bowel. You can get a toxic megacolon. You're going to have all kinds of fluid shifts, electrolyte shifts from being constipated, not able to poop because you're on those high dose of narcotics. Also, those narcotics affect your thinking. They create, abnormalities of thought, right? They can make you psychotic, they can make you depressed, they can make you anxious. So none of those side effects of narcotics are necessary with this surgery because we don't use narcotics. The only thing we give our patients is a muscle relaxer, and they don't even take it half the time. The other half take it 1 or 2 days. That's it. And then also, we don't have complications with this surgery. You can have one, but we've never had one. That's how safe it is. So we don't have complications to worry about. If you're an older person and you're having a laminectomy or a fusion or discectomy, some type of invasive procedure, and you get a complication, you can die from the complication, not just because of the complication, but because of your medical status, being old and your heart not being optimized. So you could end up dying of a complication from an invasive surgery. We don't have that happen because we've not had complications. So this is a much safer, better surgery. Plus, people are up walking the next day, same day, next day, getting exercise, getting their lungs expanded, avoiding atelectasis, avoiding pneumonia, avoiding blood clots in their legs that come with invasive surgery. So yes, this is the perfect surgery for anyone of any age. Of course, I won't operate on a neonate, but if you have a teenager who's suffering, and we do have those, I've met many teenagers with their parents virtually that have thoracic pain and thoracic disc herniations or lumbar disc herniation. And what's shocking to me is a lot of the parents, they don't want to let their child have the surgery for whatever reason. They'd rather them suffer. And I can tell you that if you don't fix your child's back when you have the opportunity to, I just think that's abuse of the child. There's a safe and effective treatment. It should be offered to the child. So I don't discriminate based on age. I just look at, is it medically necessary to do the treatment? Will the treatment help the patient, make them better permanently? Can we do it safely based on their health? And if the answer is yes, then I do it. I think everyone should be entitled to enjoy life and live life to its fullest and not be limited by pain or the treatment of pain, such as alcohol, drugs. Yeah, fine. Yeah, because that's what a lot of people do. They treat their pain with alcohol and drugs. And then their life is ruined as a result of alcoholism, drug abuse, or even, suicide. Horrible. I don't want anyone to have to go through that. That's not right. We can fix back pain now. So come to Deuk Spine and let us help you.
We have another question
Sure.
coming from RT on YouTube.
Hello, RT. Welcome.
Asking, hi there, recently diagnosed with thickening of the ligamentum flavum with mild stenosis at the L1, L2 level. Prior to this, I had a fusion at L2 to S1. What would be the best treatment going forward?
That's a great question, RT. So a lot of pain docs will try to sell you on the mild procedure. It doesn't work. It's useless, in my experience. But the Deuk laser disc repair would be your best option if you have symptoms. But I don't know what your symptoms are. So you described your MRI findings, structurally thickened ligamentum flavum. That does not mean you need treatment. So far, I don't know why you would need any treatment. If you're not having any symptoms, you don't have any back pain up there, you don't have any leg symptoms, then I would leave it alone and just try to take care of your back as best you can. You know, don't play contact sports. Don't let anybody else operate on you. If you ever need surgery, come to Deuk Spine. We'll do the least invasive treatment. And our treatments don't cause adjacent segment disease like you're having now at L1-2, right? Because you had that huge fusion from L2 to S1. Now you're getting adjacent segment disease, probably in your SI joints and above at L1-2. But like I said, don't let anyone else touch you. If you need anything, come here. Let us do a treatment that's not going to make you worse in time. All right, we're done here. I've got one more disc to go, but that's the tear. It looks big. Remember, the fiber is 1 millimeter. So that's about a 4 millimeter tear, maybe 5. Not a small tear, but it needed to be debrided so it can heal. My suction, Hector. Why? Why is my suction not working? All right, any other questions?
No current questions, but we just have another comment from RT on once more on YouTube saying dealing with numbness and tingling upon from of thighs.
Numbness and tingling in the thighs.
Correct.
Well, my friend, the best thing you can do is get your MRI uploaded on our website at deukspine.com and let me do an MRI review to try to figure out what it is that's causing your symptoms. Okay? Because whatever's causing your symptoms, if it is that 1-2 stenosis, it could be. There's probably a bulging disc, and it's better to treat the bulging disc than the ligament. But and if you decide to not listen, that's fine. I never hold it against patients for not listening to me. I don't get bent out of shape like some other doctors do. It's your body, your choice. That's my belief. You got to be comfortable with the decision you make. But if you ever do anything stupid like the mild procedure, that's okay. I still love you, and I will treat you here at Deuk Spine properly when the pain comes back or the symptoms return. I say that tongue-in-cheek, obviously, but the point is, if you are experiencing radiculitis or radiculopathy from stenosis or inflammation affecting the nerve root, which is what it sounds like, the best treatment is not to go after the ligament. That doesn't do anything. The best treatment is to go after the bulging disc and annular tear, because that will give you the best relief and it'll be permanent. Alrighty, we have one more disc to go. This has been a long case. How's she doing?
Very well.
So can I proceed?
Yeah.
How long has it been?
We've been going on now for 2 hours.
2 hours. Perfect. 2 hours is our ideal cutoff. Of course, we can go 3 hours, 4 hours, as long as the patient can tolerate the breathing. And she's been breathing fantastic. We have some special tricks that we use too, right, Dr. Berndes? To help them breathe. Wait. Let me see. Shot. All right, go. Take it out. Any other questions?
No current questions, but we do have a comment from RT once more on YouTube saying, forgot to mention that there is a diffuse disc bulge at L1, L2.
Yeah, of course you did. I already knew that though, but thank you. I know that because you know how many people I've seen, my friend, with these problems? Hundreds and hundreds of thousands. I know exactly what needs to be done. It's not complicated. It's very easy to fix. That diffuse disc bulge is what you need laser for. And if I did your laser, I would expect your symptoms to go away and they will be gone permanently. Mess around with that ligament, you're not going to get any relief, I promise you. But some people just have to go and learn on their own, and that's okay. I'm a very understanding and patient man. Doctor. I truly believe in the patient's right and responsibility to make decisions for themselves. You know, I came from an era where doctors would recommend treatments or tests and they would expect themselves to never be challenged or second guessed. I'll admit it, I don't like being challenged or second guessed either, but I think I've earned the right in certain things not to be challenged too much because it's just a waste of time. But sometimes patients want to learn. They have a genuine interest in understanding what's going on with their body and they want to know what's happening. That's why we created the Deuk Spine Institute website. If you look at our website, the website gives you a lot of information about what causes symptoms like yours, and structurally what causes it, physiologically what causes it, and more importantly, how we fix it for you in the very best way possible for you. A lot of people say, Dr. Deuk, you're always promoting your treatment, but the reason I'm promoting this treatment is because it truly is the very best, safest, most effective treatment for the conditions like yours, a bulging disc. And that's why I promote it. And the only reason why it seems unusual to people is because they haven't heard it from their other doctors. But the truth is, their other doctors aren't recommending it because the other doctors don't know how to do the treatment. They don't know about it. It's a new treatment, it's a novel, it's technically better for the patient, performs better results, but it's not something they've ever been trained to do. And the reason for that is their training is dominated by what are called implant companies. So if you go to any university hospital where surgeons are being trained in the United States or world, you will find the same thing at every hospital. There will be a company there, and I'll use examples like Medtronic or Invasive or Alphatech or Deuk, and these companies have sales reps there. They're called reps, and they're in charge of sales, and their job is to make sure that you, the surgeon, are putting in their products, their screws, their rods, their cages, so that their company makes the money from the hospital. The hospital buys those metal products and cages from that company, pays those companies like Medtronic billions of dollars a year, okay, for their devices. And every teaching hospital in America has the same scenario. So there's probably 130 neurosurgery programs in America where neurosurgeons are trained to do spine surgery at university hospitals. And every single one of them has a company that I talked about with reps there, facilitating, implanting these devices into their patients. And this has been going on now for, it happened when I was a resident heavily. It's probably been going on for 40, 50 years, at least. So they are entrenched in our educational system, these medical device manufacturing reps. And their job is to basically sell product to the hospital. And the way they do that, they have to get the surgeon to recommend it. So there is no way for them to sell their products without surgeons recommending that product be implanted into the patient. And they ultimately must get the patient's consent to have those products implanted. So you patients are giving your consent for these treatments that are basically enriching companies like Medtronic, and they don't want to stop making that money. They're making gazillions of dollars, okay?
We're just removing this from
The point is, there's nothing wrong with making money in medicine. But when you're making money at the expense of harming patients, there's a problem. And that's what I'm blowing the whistle on. And that's what the movie Spine Scam is all about. Okay? I'm raising awareness that these treatments are being done unnecessarily to the tune of 1 million plus these treatments a year. That shouldn't be done, in my opinion. And the only way it's going to get fixed is if the public is aware of it and does something about it. So I'm raising awareness so that you guys can do something about it. Ultimately, if you don't mind getting screwed by the system, then just keep going the way you're doing it. But it's getting worse. And you guys just go on Facebook and go to, Spinal Fusion Support Group, and you'll see all the catastrophes that these doctors and surgeons are creating with their fusion surgeries. And what blows me away is how the patients will defend them. Like, I saw this one x-ray of a woman who was fused from her neck down to her tailbone. Every single level screws. And that the implant company would have made at least $100,000 on those screws. $100,000 on some screws that you could buy similar screws at Lowe's for, maybe $50. But these are medical device screws, so they've passed through testing. And the company will make 100, maybe 150 grand on that construct. And of course, do you think the surgeon doesn't get their share? Of course they do. They get their share. And you wouldn't believe how many, I made a comment, you wouldn't believe how many surgeons came on there bashing me for saying this surgery was unnecessary. Like I'm some idiot and I don't know what I'm talking about. But that's the world we live in today. It's the social media world. It's the world of greed and corruption. Anyway, I'm not going to participate in that capacity, but I do plan to raise awareness so that people can one day realize what's happening to them is really bad. I've got 30 seconds on this disc, and then we're going to do our piriformis. Is that okay, Dr. Berndes? Any other questions? We're just about done. You can see the outside of the disc here.
At this moment, no current questions.
All right. So, for those of you who missed the announcement earlier, we have a new website being launched at Deuk Spine. It is coming out in a couple of weeks, so look for it. We believe it's going to be a better user experience. UX, they call it. And of course, there won't be all the code issues we've had over the last 2 years with our current site, which was built by a team out of Sweden. I'm looking forward to it. It's launch. So is Luis. Luis will be on it every day. Right, Luis? All right, any other questions? If not, we're done here. We're going to go on to the piriformis release.
At this moment, no current questions.
All right. Again, her tears, just as a side note, they're huge, like a lot bigger than most people. And look at how they're so wide, right? And I take the tube back and they stay wide. That's because they're scarred open, but they will close. It will take time. The reason why they're scarred open is because she's had this for so long. If you look at her pain history, her pain became constant 10 years ago. So my message to you guys is if you have a disc herniation or a disc bulge, get it fixed early at Deuk Spine before it becomes a gaping hole. Huh? Is this the new one?
That's a new one, but I believe the problem is
The tube.
yeah.
Yeah, you're probably right. I don't understand how we can bend the tube, right? I mean, we'd have to bend. the tube and the dilator. The dilator looks a little bent there. That looks a little bent to me. But check it out. All right, folks, we are done with the DLDR. We're going to do the piriformis release next. We lost about 10 cc's of blood the entire surgery. Not bad.
Thank you.
A lot of what you see is not blood, it's irrigation, which is saline. What's wrong? A little blood splatter? Where? Where do you see it? Oh. Probably when I was putting the dilator down, you know, because sometimes the blood shoots up and out. Thanks for joining us. Actually, let's go ahead.
Let's keep it going. Yeah.
Let's keep it going for the piriformis.
Yes.
Let's bring in the machine and we're going to do our piriformis release. For those of you who don't know, the piriformis muscle runs from the sacrum over to the top of the hip and it gets torn. You get scar tissue built up inside the muscle and then inflammation, and that creates a horrible pain. What's going on, gentlemen? Anyway, Henry, let's show the audience how the piriformis muscle becomes injured and how it causes so much pain. More importantly, how we fix it with minimally invasive treatment here at Deuk Spine Institute. By the way, this treatment is patented here by myself as I pioneered it. It's a novel treatment.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from our video animation that once you get a tear in that muscle, the piriformis, it's so hard for the muscle to heal itself. It rarely ever does. Shot. Oh, it's perfect. And we are just about done. This procedure is bloodless and there is no loss of function. A lot of people worry, oh my gosh, what happens if you go in there and cut some of the muscle? Aren't I going to lose my strength? No, you're not. As a matter of fact, the piriformis muscle is like a totally unnecessary muscle for hip rotation. You've got much better muscles that do that. So it is pretty much useless. It just sits there and gets torn. And then once it's torn, it hurts like heck. All right, we're done. The incision is a 4mm incision. And we are, thank you, Luis. We are getting ready to put our staple on it. Now, she's got a bunch of staples that will come out tomorrow. The only thing people complain about is they complain about pain in their hip, like right here, where we do the treatment inside. But other than that, you can see there's no bleeding. It's very quick and very easy to do. Okay, what's the question?
From Raphael on YouTube.
Yes, Raphael.
Asking, I have 4 bulging discs in my lumbar and was thinking about disc seal. What do you recommend?
I get this question a lot, Raphael. Thanks for asking. Disc seal, in my opinion, does not work. I have seen a lot of patients that come here in pain from their disc. They've had the disc seal procedure. It does not work. That said, if you do it, you know, it's pretty safe procedure from my experience. The chance of a complication is not very high, but you're wasting your money. You're wasting your time. It will not work. It doesn't work. It's a great idea when you watch their videos and everything. It makes sense. However, it doesn't work. That's the problem. It's great if you're an investor in the company on Wall Street. You're making millions of dollars on your investment. People are getting it done, but it just doesn't fix people's problem. So that's why we don't do it here at Deuk Spine. It's easy to do. It would take me 5 minutes. I could make a lot of money doing it, but I don't do it because it doesn't work. All right, thanks for joining us. We will be back shortly with one last surgery.
And good morning, I'm Dr. Deukmedjian. I'm here with one of my lovely patients who she had some words of wisdom for me this morning. Keep smiling. And you're smiling a lot today.
I am out of pain.
Out of pain, good. So she had a piriformis muscle release done. How do you feel?
Good for morning after.
Yeah,
Good.
feel good.
Ready
And
to go.
Can you tell if that piriformis pain is gone or is it still there?
It's gone. It's just from the pressure from the surgery, but I'm good to go.
Yeah, everybody has a little discomfort from the
Yeah,
surgery,
I
but
understand that,
you can
yeah.
tell the piriformis pain is gone.
Yes.
Congratulations. We
Yeah.
did it with minimally invasive, 4 millimeter little cut on the back of your hip there. And we just go in with our probe and we cut up the scar tissue that's, causing all the pain, release the muscle, and that causes the pain to go away right away. So what was life like for you before when you still had this horrible pain?
Very restrictive. I wasn't walking. PT, wasn't even helping. And the injections, that was ongoing with Dr. Patel for a while. But I hope to get back to life.
That's it.
No pain. That's the biggest thing. That takes too much out of you. It's not a way to live.
A life in pain is
Yeah.
not good. Or
And I
afraid
was
of,
miserable. I was making everybody miserable.
or fear of pain, by doing
Yeah.
something to set it off.
Yeah.
Now the pain you had in your buttock, this piriformis pain,
Uh-huh.
was it constant or did it kind of get worse with certain activity?
It got worse during the day. The
Yeah.
more you did, and you just have to back off. I did ice and heat. And Dr. Patel did the injections, and it's just not immediate relief, but, I got some. But no, yesterday was a good thing.
Now you're a dog lover, right? And you have a new puppy, you told me.
Yes, I have a little mini schnauzer, Darby. So
Darby.
now I can go with her. I can run and pick her up.
And that's it. Picking up is key because when you bend over to pick something up from the ground like a little dog, it usually aggravates the pain from the piriformis in the buttock. All right, so anything else you want to share with your viewers and fans out there?
Don't let it go. Get help, come to the clinic, and enjoy life now. I really will.
Congratulations, you took
Thank
the leap
you.
of faith and you got it done. Go enjoy life.
Have a glass of wine on me.
Right. Sounds good. Let's get you out of here.